Okay, so now we'll move on to our next presentation. I'd like to welcome Simone Sheridan to the seminar. Thank you so much for joining us, Simone. And Simone works as a sexual health nurse consultant at the Austin Hospital in Melbourne, where she sees clients experiencing a range of sexual difficulties as a result of illness or injury. She also works privately as a nurse consultant with the organisation Thrive Rehabilitation. She's passionate about supporting health professionals to have conversations about sex and intimacy and regularly facilitates education on this topic. Prior to specialising in sexual health, Simone worked as an ICU nurse and clinical nurse educator at Peter MacCallum Cancer Centre. Recently, Simone appeared on the ABC program Conversations, and stories from her work were documented in the book, The Care Factor. Thank you so much, Simone.
Thank you so much for having me. It's so great to be here today, being able to talk to you about a topic that's very close to my heart, which is those awkward conversations, talking about sex and intimacy. Gosh, they can be awkward at times, can't they? Whether that's talking with our health professionals or talking with our partners, things can feel a bit tricky. And I guess I just want to say from the outset, I love talking about sex. Absolutely love it. And I think that's probably a really good thing, because that's what I do a lot of the time in my work. So like Alicia was saying, I talk with patients from a wide variety of background, not just cancer, but patients that have had a spinal cord injury or a stroke, or something else that's an injury or an illness that's impacted their sexual function. And I also talk with health professionals about building confidence into how we can have these conversations in a healthcare environment, because we really need to. So I'm hoping today in this short presentation, we can talk about how we can hopefully make these conversations a little less awkward. So from the outset, I want to just say, this is a very obvious thing, but sex is not just about making babies. Like, babies are great, babies are very cute. We wouldn't be here if babies weren't able to be made through sex. But I think this is one of the things that gets in the way of us having conversations about sex and intimacy, is that we tend to feel much more comfortable talking about fertility. You know, if there's an egg and a sperm and we're talking about fertility or fertility preservation or contraceptives, it's awkward, but it's not that awkward. Once we stray into the realm of pleasure and fun and arousal, things get really, really tricky as well. So for this talk, we're not going to be talking about fertility. We're going to look at the other aspects of sex and intimacy. So the World Health Organization takes a really broad view to the idea of sexual health. You know, it says that it's actually a physical, mental, and social well-being in relation to our sexuality. We all have a sexuality. It's a very unique thing to us. And it's really important that we don't just look at sex in a very narrow way, but we take a very broad view to sexual health. And the World Health Organization also says that it's everyone's right to have pleasurable and safe sexual experiences, safe being the key here, that are free of coercion, discrimination, and violence. And I want to say from the outset that we're going to be talking about sex for the next 20 minutes or so. And not everyone's sexual experiences are positive. So really important that we put out there one of the great supports that are available in Australia, which is 1-800-RESPECT. This is our national sexual assault and domestic violence family counselling service. So if anything we're talking about today brings up thoughts for you or feelings, or if this is something you'd like to talk to someone about some experiences you've had in the past or are currently experiencing, please reach out to 1-800-RESPECT. It's a fantastic service. Okay, so we're going to talk a little bit about intimacy. You know, I think sometimes when we're thinking about how am I going to have a conversation about sex, intimacy is a great word because it's a bit of an easy way to ease into things. I'm sure we're all pretty familiar with this concept of intimacy, that it can come in many different forms and that it's a closeness in a relationship. It's a sense of connection, of safety, of trust, and of love. And yes, there's sexual intimacy, which we will talk a lot more about, but intimacy can have a physical element that's not sexual. Intimacy can be emotional and intimacy can be spiritual. And I'm sure thinking about the relationships in your life, there's varying degrees of intimacy with people. And when we're thinking about sex as related to intimacy, we kind of need to dive a bit deeper into, okay, well, what is sex? If intimacy can be so broad and can happen between so many different people in different relationships, what is sex? Now, I'm sure if I got you to draw me a diagram or tell me what sex is, there's a pretty dominant narrative in our society that there's generally genitals involved, there's often a penis and there's a vagina, and things happen between those genitals. But I think what we need to do is actually step back and look at sex much more broadly. And, I love this definition of sex, that it's a physical contact that brings excitement and pleasure and connection. Because in actual fact, our two biggest sex organs are not our genitals, it's our brain and our skin. And we can experience sexual pleasure and sexual intimacy in such different ways. But sometimes we get really caught up on what's not working and the specifics of what we think makes traditional sex. And, even that idea of physical contact, I was thinking about, like, over the pandemic and times during lockdown when people weren't able to actually come together physically, there was actually a lot of sex that went on. During that time was the highest sales of sex toys. And there was a lot of people connecting in physical ways that maybe they were touching themselves whilst being in contact with someone else digitally as well. But if we're talking about what sex is and all the broad things that sex can be, we also need to talk about what sex is not. And sex is not limited to intercourse. I think this is a really important thing, that if we're going to have sexually satisfying lives, we need to really step away from that idea. And also really important that sex is never a should and never a have to. This is something that people want to engage in because it's something that's pleasurable for them. And if it's a should or a have to, that's not sex. That's actually rape or sexual assault. Okay, but thinking about what are the benefits of safe, pleasurable, consensual sexual activity between two adults who are like, this is what we want to do. And whatever variety of sexual activity that happens, what are the benefits? Why do we get so excited about it? And why am I actually here talking to you today? Well, there are so many things in the literature that tell us how good sex is. How good is sex? It improves our sleep. Thinking about the sleep talk that we just had before, sex is also a great strategy to help with sleep. It counts as exercise. It can have those physiological benefits on our blood pressure. It can really establish a sense of intimacy and connection through the hormones that are released as a result of sexual pleasure. And again, those endorphins that are released can give us some level of pain relief as well. It can give us a sense of well-being in ourselves and in our relationships. It reduces stress, and it's pretty bloody fun. There are so many reasons why being sexually active with someone that we love and that we're in a relationship with that feels good to us can bring really good benefits into our lives. And there was a doctor that I used to work with that I loved, that she had this quote. She said, if sex was a pill, we'd prescribe it to everyone. So this is it. It's really important. And we are all sexual beings from the time that we're born until the time that we die. We never stop being a sexual being. The ways in which we express our sexuality, the types of experiences that we like to have, the types of activities that we want to be involved in, that's going to change over our lifetime. And so there's going to be a huge amount of diversity in how we express ourselves as a sexual being, but that's always going to be there. This is part of what it is to be human. And we know from the research as well that sex is it's a part of quality of life. It's a really important thing to people. And again, it comes in many different forms and different ways, but it is something that concerns all of us. And I think sometimes I'm sure you've probably heard many times this idea of the cancer journey or the myeloma journey. And, sometimes that can feel a bit irritating, that kind of terminology. But I think sometimes it's a bit useful to think about, especially if we're thinking about sex and intimacy, that we all come as individuals to the point at which there's an illness or an injury, such as myeloma, that happens. And there might be a whole lot of baggage that we're already carrying. There's a whole lot of things that might have happened, thinking particularly about sex and intimacy. There might be ways that we already relate to our body or don't relate to our body. There might already be levels of sexual dysfunction going on. And then we add on an illness such as myeloma, and we add on treatments, and we add on medications, and that can really disrupt that connection with our sexual selves. And what we do know from around the world, that this problem is actually really understudied. We don't know a huge amount of the detail specifically about people with myeloma, but we do know some kind of broad information about people with hematological malignancies. And we know that they experience sexual problems at a greater rate. And this makes a lot of sense when we think about why it might be. And we know also that people who've had a stem cell transplant, looking 5 years into the future, a lot of these people are reporting that they do have sexual dysfunction. And I want to say from the outset that a sexual dysfunction is defined as a sexual problem that's causing distress to somebody or distress in the relationship. There are lots of changes that happen to a body over its lifespan that don't cause distress. Things might change and someone might go, that's changed, that's okay. In that case, that doesn't get classed as a sexual dysfunction. It's classed as a sexual dysfunction when it's actually causing distress to someone. But we can see that there's actually a need to talk about this in healthcare. And these types of problems might arise in many different areas. So it might be a case that there's a loss of libido or desire, this feeling of wanting to be intimate with someone. That can really change over the course of someone's cancer treatment. There can be changes to arousal, and that might appear as if you have a reduction in vaginal lubrication. There might be erectile dysfunction for people with penises, and there might be some changes to how ejaculation happens. And these types of dysfunction, particularly that reduction in lubrication, might lead to a feeling of dyspareunia, a painful intercourse. We know as well that there's lots of things in myeloma treatment that can actually damage the sensitivity of nerves. And those nerves also exist in our erogenous tissue. So we might get this decreased sensitivity of that tissue. And that might then lead on to a reduced ability to achieve orgasm. And as well, infertility, although we're not talking about fertility a great deal today, is a really significant sexual problem for people as well. So what causes these difficulties in the case of myeloma? There can be lots of physical illnesses that actually contribute directly. So there might be the myeloma itself, but there might also be other illnesses that someone else has going on in the background, whether that's high blood pressure, diabetes, other respiratory illnesses, other neurological illnesses that can cause sexual dysfunction directly. But then there can be kind of this secondary level of the treatments and the medications that are so important for treating these illnesses. A lot of them have really quite profound sexual side effects, whether that's our pain medications, whether it's the steroids that can lead on to having more diabetes and damage to nerves that way. We can actually see that many medications and treatments, whether it's chemotherapy, radiotherapy, different types of surgical treatments, can also cause dysfunction in their own right. And then there's those secondary effects of pain. Pain is a very huge turn off, isn't it? Like it's something that makes your body not want to go into a place where there's intimacy and enjoyment in physical sexual activity. And fatigue is a big one for people that are suffering from anemia, that effort that it might take to get into a place where sexual activity feels fun. And fear, I think, is really important to talk about. If someone's scared about an infection or a risk of bleeding, or if there's a partner who's really feeling really cautious or scared about hurting their partner who might be going through cancer and has myeloma, fear is a really powerful anti-arousal agent. And then, of course, any associated depression and anxiety and the medications that go along with that, any physical impairments, the relationship changes that are huge, the body image changes, the role changes, for someone who's used to having a certain role within their relationship. And on top of all of that, there's those normal impacts of aging. As a body grows older, a lot of those neurological pathways slow down, and a body's ability to, engorge blood vessels slows down. And this doesn't mean that sexual satisfaction is not possible. It just means that there might be the need to go about things in a different way. So you can see that, for someone with myeloma, there's so many reasons why this sexual dysfunction might be happening. And it's going to be very individual to that person's treatment and their pre-existing conditions. But we don't talk about it. So why is this that we've got such a problem that's going on in the background, and we know that it's a problem for people that they want to talk about, but unfortunately healthcare professionals are in a place where they're finding that they seldomly discuss these issues. So this figure here, 68% of healthcare professionals saying, I don't really talk about this with patients, comes from a huge European survey of health professionals working in hematology specifically. Interestingly, though, when they asked those same health professionals, did they think it was important to talk about this? 95% of them said, yeah, we think this is really important to talk about. So why are we not having these conversations? I'm sure you get this, that there's really big embarrassment factor. And there's an embarrassment factor on the part of the health professional, and there's an embarrassment factor on part of the patients. And both in the research, what we see is both patients and health professionals, they want the other person to ask. If the other person asks, really happy to talk about it, but I feel really uncomfortable bringing it up. And there can be worries in the background on both sides about causing offense. Like, what if I actually offend this person? Am I making an incorrect assumption that, that person's too old, too young, of a different background to me, a different religion? Maybe they don't want to talk about it. And, we all just don't feel very confident talking about sex. It's interesting. You look at billboards, you look at magazines, movies, sex sells. Sex is everywhere in our Western society. And yet we're not very confident about having these conversations and, about the language we might want to use as well. And I think both healthcare providers and patients feel that real pressure, that lack of time or lack of privacy, or maybe this is not important. There's a lot more other important things going on right now. But what we do know from the research is that patients, and I'm really sure that you can back me up here, patients and their partners do want information about the effects of illness and treatment on their sexuality and intimacy. And we see this right across, not just cancer, but right across a lot of illnesses and injuries. People are saying, I want this information, but I'm finding it really hard to ask. So this is something that I'm heavily invested in, is actually helping health professionals develop these skills. And there's been a real change in recent years in training programs around supporting health professionals to realize, actually, it's your job to bring it up as well. Don't just rely on someone asking a question. Make it really easy and provide an opportunity for someone to ask if they'd like to ask. And I think that I'm really hoping, and maybe you can say in the chat or at the end when we have questions, let me know, have you been asked a question? I'd love to hear if there's been maybe a form that you were filling in and there was a place where you could tick to say, yeah, I'd like to talk to someone about sexual function. Or maybe a health professional said something like this to you. They might have said, many people with myeloma have questions about sex and intimacy. Is there something you might like more information about? And that's a really lovely way of being asked, because you can say, yeah, I do, or no, actually I don't. So it's a really invitational way. And this is something where we're trying to make sure that health professionals have in their toolkit. But I think probably there are lots of health professionals still who fall into that basket of, I feel really embarrassed and I'd like the patient to ask me. And so I'd like to give you a couple of tips just in case you have a health professional who feels a bit embarrassed but is waiting for you to ask. Here's some ways that you might be able to bring up your questions. So the first thing is, please know that this is an important health issue. There is so much research of both healthcare professionals and patients saying, yes, this is important. And I know that you're in a situation with myeloma where you're dealing with life and death issues. You're dealing with really big things and you're talking to someone about, potentially curing or prolonging your life in all of these ways. This is also an important quality of life issue. And so taking time to talk about it is valid. Choose who you feel comfortable with. It might, it's really hard sometimes picking the person who's going to be able to help best. So start with the person that you feel most comfortable with. If that's your physiotherapist, if that's your doctor, if that's your nurse, whoever the person is that you go, I could start there, that's probably the best starting point. If you have a session with someone and you think, I'd like to ask some questions, one of the most common things that happen that we hear from health professionals is that patients right at the end of the session, they're reaching for the door handle to leave the room and they're like, oh, by the way, I've got a question about sex. That's a really hard time because it's quite a thing that we'd like to spend a bit more time talking about. So at the start of the session, if you want to ask a question, flag it early. And that's a good time because you can walk in with the confidence and you can say, actually, I've got a question about sex that I'd like to talk about in today's session. And then it's up to the healthcare professional to make sure that gets covered. Write down your questions. If you feel like, God, I don't know if I can actually say this out loud, write it down and say, hey, I've got some extra questions. Pass over your bit of paper. That's another great way to go about it. And look, if you don't get the best response, if you feel like that person doesn't respond in a way that's helpful or doesn't give you enough information, try again. You'll get better at it each time. Please don't feel embarrassed. Sex is a part of life. And so how it's impacted by your diagnosis is just another regular topic for discussion with your health professional. And that's what we know. Health professionals are really happy to have these conversations. It's just that they might be feeling a bit like you in that initial kind of initiating the topic feels a bit tricky. And there might be different questions you want to ask. And, I'm sure that you'd have your own list, but here's just some that I've heard from people that, have come up for them. They might have questions around how does myeloma or the side effects of my particular treatment affect my sexual activity or affect my sexual function? Like what's going to happen? Or I've noticed something's changed and what could be causing those changes? Because the more you understand about what's going on with your body, the more power you're going to have. Somebody might be giving you information about, okay, I want you to make sure that you wear a condom while you're on particular therapy. Make sure you understand how that applies to lots of different types of sexual activity. So you and your partner might enjoy engaging in oral sex. Instead of just going, oh, I wonder if that applies to oral sex, actually ask it. And like, okay, well, how about oral sex? How about anal sex? What do I need to do in these particular situations? Are there any specific precautions? Or you might be at a place where being intimate and being sexual has been something that's been completely off the cards, not something that you've wanted to engage in. And now you're involved in coming back, in a survivorship perspective, or you've, finished your treatment and maybe you're scared about resuming that intimacy. Or maybe you're still having treatment, but you're at a point now where you think, oh, how could I get back into this? That's a really good question for your health professional as well. So your health professional can then provide information and education. Like I said, the more you know about the types of medications, the treatments, and how they impact your sexual function, you're not going to be second guessing it and going, oh, maybe this is happening for other reasons. Maybe I'm less attracted to my partner. You can go, no, this is happening because of this particular treatment that I'm on. Look, there might be some extra investigations that need to be done. We know, for example, with erectile dysfunction, it might be that it's happening as a result of chemotherapy, but it might also be there's something else going in the background. So there might be some extra things that can be looked into. Your health professional can talk about, well, what are the treatment options? Can we actually change any of the particular medications that you're on to pick, for example, there are certain types of blood pressure medications that are much more likely to cause sexual dysfunction than others. And of course, you want to have those discussions to go, well, what's going to be a safe option? There might also be options for medications, for people with penises experiencing erectile dysfunction, the drugs like Viagra might be an option. Talking about that with your health professional is really important. And then they can also open up other options in terms of referrals. So I think there's a lot of support that can be provided, and it's definitely worth checking in to find out what can support you. But communication is not just with your healthcare professionals. And actually, probably more importantly, in sex and intimacy is that communication in relationships. I think particularly when there's been a really life-changing event like a cancer diagnosis, that can bring people together and it can actually force people apart. And it can mean that they don't talk about what's going on with their bodies. Or maybe in your relationship or in people's relationship, there's been a level of, we've got a sexual script that works for us. I do this, you do this, I feel good, this feels good, that feels great, great, we reach the end. And maybe that's how it's worked for 20 years. And then suddenly there's a diagnosis and there's all this treatment and medications, and that sexual script doesn't work anymore. And this might be the time to actually open up some conversations. So here's some tips or some ways that you might want to talk about things with your partner or your partners. So maybe it's about having a conversation. What does sex or intimacy mean to us? How important is it? What does it look like? What activities make us feel connected? At times when connecting sexually in the way that we used to is not going to work at the moment, what can we do to keep that pilot light burning? What are the things that we really enjoy doing together? What are the things that feel pleasurable? I think sometimes when we really narrow our view and we say, well, I can't have this particular type of sex anymore, therefore, whatever, I'm throwing my hands up, I'm done. But what actually feels good? There's going to be times when maybe having someone give you a foot massage, play with your hair, stroke your back, have a naked cuddle without any pressure for it to go anywhere. What's going to feel nice? How can you follow that pleasure without having this idea of it has to get to a certain destination? And really importantly, what are you both worried about? I think this is really a crucial one, because you might feel like, I know that I've heard from people in relationships feeling like, oh, since I've started treatment and my body's changed, I don't think my partner's attracted to me anymore. But what's actually going on for that person is they're really worried about hurting you. And unless you have that conversation about what are you worried about? What are you scared about? We need to actually open that up so we can start to have that dialogue. And a big tip, can I please give you one big tip? Any of these conversations, have them outside of the bedroom. It's going to be much easier for you and your partner having these conversations when you feel connected at a time that's not in the bedroom. Go for a walk somewhere, sit by the river, have a chat after dinner with a cup of tea. But yeah, take it out of the bedroom. You'll be surprised at how helpful that can be. So look, this is just such a short session, but there are so many things that can be really helpful in terms of reconnecting intimately with your partner. One of the big things, talking, reading, learning together. Sex is between two people. It's the couple's problem. It's not one person's problem. It's not one person's failing or inability. This is something that you need to work on together. So I'm going to give you some resources, but maybe picking one of those and looking at it together. Be up for trying new things, whether that might be trying a medication. Instead of seeing that as a failure, like, oh, I need to use this particular medication now to get aroused, maybe going, oh, I wonder what this could be like. Might be trying a different device, some vibrations, some different toys, taking the effort out of sex and bringing back in a sense of fun and play and novelty. Like if you think back to when you were a teenager and when you were starting to explore sex for the first time, it was pretty exciting and pretty fun and pretty nerve-wracking. And unfortunately, when it gets to the point later in life that things aren't working, they used to work, they're not working anymore, it can get pretty hard and we get focused on what's not working. We start getting really down about it. Sex starts feeling like a really heavy thing that I need to do something about. And gosh, that's not working either. And what we want to do is throw all that out the window and work out what's going to be fun in terms of reconnecting. Maybe we need to ban sex for a while so that we can actually go, what are we going to do to have a sense of play and fun together? And we might need to plan this in terms of connecting together intimately, might need to plan what time of day is going to work. And I think sometimes we think about sex and intimacy should be spontaneous and it should just happen. And in reality, anyone who's had kids, lived a life, had a job, you know that that's not going to be the case. That actually for everyone, and particularly for people with an illness, we need to think about what time of day, when am I having my medications? How do I feel after those? What sort of positions are going to feel comfortable? What sort of activities do I feel up for at the moment? But that sense of planning together can give a real intentional nature to sex and intimacy that can be really satisfying. So I think if you take one thing away from today's talk, it's that we really need to keep an open mind about sexual pleasure. You know, there's your comfort zone, what you're used to, how you think sex works for you, and there's probably a whole lot of magic that can happen just outside of that. So some great resources to finish off with. The Cancer Council, fantastic booklet. Get your hands on it. Read it cover to cover. Read it with your partner. This book is regularly reviewed by sexual health professionals as well, so it's got lots of really good tips in it. There's a new book that's been brought out by, she's an OT, her name is Tess, and Tess is she's an OT, but she's also had cancer herself. She's got some great tips on rediscovering intimacy after cancer. I love this book, Come As You Are, by Emily Nagoski, who's a sex therapist in the States. It's particularly for people with vulvas, but it has some really great activities for everyone. And if you feel like just zoning out, but getting a bit of education in the meantime, The Principles of Pleasure on Netflix. It's going to give you a whole lot of interesting things to talk about together. There's also a great card game. This has been produced by a Melbourne couple. It's not a sex game, it's an intimacy game. There's a timer, there's cards, they give you little tips, prompts for conversation and prompts for things that you might like to do physically that are really no pressure activities, but it's a lovely way to reconnect. But of course, if you'd like to have a bit more of a deep dive into what's going on in your relationship, Relationships Australia does great couples counselling you can organise through there. And also if you want to think about a bit more about getting some more help, particularly around re-establishing, sexual intimacy with your partner, the Society of Australian Sexologists can point you in a good direction. So wrapping up, 3 things that you can do after today. Please talk with someone about this session. Like, I know that sounds really naff, but actually just getting a bit of confidence using the word sex in a sentence and feeling okay with that is really powerful. So find someone today, whether that's, maybe it's your friend or your neighbor or your partner. You could just go, oh, you know what? I heard this really interesting thing today. I heard something about sleep. I learned this thing. And then I heard this talk about sex. And I thought, yeah. And that's a really great way to start thinking about what might have resonated with you. Maybe write down those questions. If you've got those questions, you think, I want to ask those questions, write them down now. And I'd also, one of the, I guess, a little challenge I'll set for you is find one of those resources that I've mentioned and look it up and have a read. Because the really important message is that your sexual health is such an important part of your overall health, and it's such an important part of quality of life.
Thank you so much, Simone. That was just really interesting. And I'm sure I am not the only health professional watching this video going, wow, I really need to think about the kinds of things that I talk to my patients about. I definitely, when you were putting up those statistics, I definitely thought to myself, I am absolutely guilty of that. I
think it's that thing, isn't it, that we're busy, we're focused on a whole lot of medical things, we're trying to get through things. And like we see from the research, health professionals go, yes, this is important. Like, we all acknowledge it's important. And we have such a role. There's so many suggestions and helpful places we can point people to. But you're right, we're human, and humans are inherently embarrassed about sex. That's okay. Like, I think we'll get there. And I think if we're both trying, if our healthcare professionals are trying and our patients are trying, we're going to meet in the middle. Like, we'll make it work.
So there's patients out there watching, challenge us,
Yes.
Do ask
yes.
questions. Yeah, and we will learn together.
That's it. There's one thing that health professionals are fantastic about. If someone asks a question and they don't know, they're going to bloody go away and find out as much as they can about it. So you're actually helping your health professional learn if you ask them a question. And if they don't have the answer, that's okay. Yeah.
I was writing down those resources. So I did a bit of research going on. Now, look, we do have a question from Deb. So she asks about the impact of steroids and mood swings really impacts the intimacy, what are some tips to manage that?
Yeah, thanks, Deb, for asking about that. I think steroids do lots of things to our body that make sex and intimacy particularly difficult, but I think the mood swings is a huge one. And I would say start really small. And what I mean by that is sometimes if we put a lot of pressure on ourselves to connect intimately with our partner for extended periods of time, like Deb probably realizes, you get pretty frustrated or annoyed, or other feelings come up, or you feel like, oh, but maybe it's about, for example, with that game I mentioned, the game Yum, maybe it's about going, can my partner and I spend 5 minutes 3 times a week? Like make it almost so small that it feels like, oh, well, of course I can. And then pick a time, start noticing when those mood swings are at their worst and when they're at their best, and going, don't push it. If you feel like you're in a bad mood, it's not the time to try and connect, but harness those moments where you are. Notice where those golden moments where you're like, oh, I actually feel okay right now. Maybe that's the time that I go in for, and I say, can I actually have like a little cuddle for 3 minutes? Can we do that? Or maybe that's the time where we go, let's sit down and both pick out one of these cards and ask each other that question. Because those cards, they have lovely prompts on them to get you. There's so many. I mean, they were made by a couple who spent a lot of time researching this with lots of different people. And it's a nice way. And it also is a bit novel and it's a bit fun. And so it's not you having to think about how you're connecting with your partner. It's like I pull up a card and the card says, tell your partner about the first time you met and what you thought of them, for example. And so then you think, oh, I know I've got to tell my partner this. And that immediately re-engaging with pleasurable memories from the past is a really powerful way of harnessing good feelings as well. So I would say find something little that feels, and find it that you can put it in at a time when you are feeling good. And when you're having those big mood swings, that's okay. You'll get a bit more resilience in the background to kind of keep that intimacy going.
Simone, I think exactly what you were saying before, sex and intimacy is not necessarily intercourse, and thinking about it differently, and resetting our mindset about it. And
and one thing I hear from people a lot is that they're really worried about letting their partner down, and they're really worried about not catering to their partner's needs. And especially as the person who's been unwell and sick, there's this feeling of, but my partner's doing all this for me, they've taken on extra chores, they're taking me to appointments, I should at least be able to provide for them sexually. And there's this such a feeling of weight and burden. And I think that's where we really need to step back and have these honest conversations with partners about how we're feeling, what we're worried about, and putting in place small activities that mean that we are coming together in a space that we're connecting outside of the cancer. Because, when there is something like myeloma going on, so much of the conversation and the day-to-day is about what's going on in terms of treatment. But can we carve out these little moments where it's about, I really like you, and how can we have that connection? Because that's the pilot light, that's what keeps that connection in the long term. Yeah, keep the pilot light burning. You might not be able to fire up that heater or that engine at the moment, and that's fine. That makes a lot of sense as to why you can't.
Spark the light.
But if we keep that pilot light just there, it's going to be a lot easier later on to fire it up again.
I feel like I could talk with you all afternoon, regardless of what anyone else is thinking right now. We totally could. I'm learning so much, and I really hope that for everyone out there watching that you've learned a lot from Simone as well, and it's made you think about things a little more, and bring some benefit to you, because we are thinking about wellness, not just about our disease and myeloma. We're thinking about our whole life
and living as full humans, and that's it. Our sexuality is a big part of that. So yeah,
yes, absolutely. Well, thank you so much.
Thank you so much for having me.
Yeah, no, it's a pleasure. I'm sure we'll have you back again.
Love to come back.